Hey friends, Dr. Celestin with Celestial Plastic and Reconstructive Surgery here. I wanted to talk to you about one of my favorite topics, Love Island. No, not the dating drama, but some of the drama around health concerns that come up with the show. So, a couple of the people on the show, who I'm not going to name here, allegedly have cold sores that are very easily visible during their confessionals and going about the show. And people are freaking out about, oh my gosh, how could the producers allow this? How could the producers not have screened them and tested them for this, among other things? So I thought it would be a good moment for us to have an educational corner about herpes simplex virus, the virus that causes cold sores. So it goes by a few names: cold sores, herpes labialis, and herpes simplex virus. So we're going to continue to call it herpes simplex virus, or HSV. HSV is extremely common in the adult population. Something about like 75% of people are carrying this virus, have been exposed to this virus, have this virus. And just because you haven't doesn't necessarily mean that you are, number one, contagious, and number two, that you have any of the outbreak symptoms. It is the kind of thing that once you get it, it lives with you forever. But you could have gotten it from like your mom kissing you when you were a baby, literally, with obviously no STI component there. It can be transferred from the lips to the face, and that virus gets into the body. It lives in the nerves of our skin. It's usually taking an opportunity when you are stressed out, when you have a cold. That's why people call it a cold sore, because it's usually associated with a depressed immune system. When you are dehydrated, and those kinds of situations, or any combination of those situations, will allow an outbreak to happen. On Love Island, you have all of that happening at once. They're being filmed all the time. They are drinking probably more than they usually do, and I don't mean water. And you're seeing that play out by some of the cast members having cold sore outbreaks. So the truth about how HSV is transmitted is that even if you don't have symptoms, you can transmit it. It's something like 10% of us have it in our saliva, so it's able to be transmitted even if you don't have an active sore, which is really gross when you think about dating shows like this, where people are doing a lot of spit swapping. And even if the person doesn't have outward symptoms of cold sores, they may still be carriers. We can't tell, just based on who's presenting with symptoms, who brought it to the island, so to speak. There's not necessarily an easily identifiable patient zero in this case. Even if someone is presenting with symptoms first, doesn't mean they're the ones who brought it first, and they're definitely not the only one. Could you have tested for it in advance? It would not be helpful, because again, remember that 70% statistic, we would be screening out 70% of people who might be potential contestants for the show, because a screening test for HSV, it does not distinguish whether you have recently gotten it, whether you got it as a baby, whether you are actively shedding virus, or whether it is dormant in your system. The only thing it picks up is antibodies, meaning that your body has been exposed to the virus and has produced an immune reaction to the virus. But you may be one of those people who, mama kissed you, you got it, and you never got a symptom a day in your life, and you don't even know you have it. And then here you come along and you test positive for HSV, and then you're eliminated from the show. So you can't realistically pre-test for it. However, my advice would be, in any situation in life, limit the number of people that you are kissing, because kissing can come with not just HSV. Fun fact, whether you have genital herpes or oral herpes, they can go to either location. It does not mean that you cannot transfer it from the lips to down below and from down below to the lips. So either way, once you have an HSV outbreak with those sores those sores are basically multiple little vesicles filled with fluid that contains billions of viruses that are waiting to infect you. So when a person has an outbreak, it is so important that person is using proper hand hygiene, that they are not touching their face a lot, that they're not sharing lip balms, straws, cutlery with other people. And it's best that they definitely don't handle that sore with their hands. And if they do, they must wash their hands thoroughly. As you can imagine, kind of a yucky thing people don't really like to talk about, but it's something that's so common, and I hate the idea of people being judged so harshly for it, because most of us have it, or most of us under the age of 50 will get it at some point. The only thing I will say that the producers could probably be doing differently is, if someone has signs of an outbreak on their face, nose, mouth, these areas, it is best to definitely limit that person's contact with other people. You may be wondering what treatments exist for this kind of outbreak. There are several over-the-counter treatments, a lot of lysine-based treatments. So oral lysine or L-lysine is a good treatment, and it's a good daily suppressive if you want to take something that isn't necessarily an antiviral pill. Also, there are topical lysine things that can be applied. Again, that's kind of on the more natural end of treatment options. People talk about camphor and other things. But really, the main issue when you have a cold sore outbreak is not only the appearance. Obviously, you want it to fade as quickly as possible, but it's also quite painful. So Tylenol and ibuprofen are two good treatments for the pain associated. Also, ice packs and some of the topical medications also have a little bit of lidocaine, a little bit of numbing medication in them to take the sting off of them because they are, again, very painful. Abreva is one of the topical over-the-counter medications I can think of that would also help with the discomfort. When you're talking about prescription medications, there's topical and then there's also pills. With all of these medications, the key for treatment is to, at the very first sign of a tingle, you may have even heard this in a commercial. As soon as you feel a tingle, you need to be applying that topical medication or taking that oral medication or both, depending on what your doctor recommends, to suppress that outbreak. Because once it starts tingling, the virus is already active and awakened in that skin distribution, in that skin area, and you may even see redness. Anytime you see any of those early signs, you want to attack it right away to minimize the amount of damage and vesicles that are going to pop up and scarring, and scabbing and scarring that may happen. Sometimes if you catch it early enough, you can suppress that tingle and redness all the way down to nothing, or at least you can minimize what the outbreak is going to look like. I would imagine, or I would hope, that a medic on set would recognize what's happening to these guys and give them some medication, topical and or oral, to kind of beat back that outbreak so that it doesn't look that bad. Because after all, these poor people are getting a ton of FaceTime, and I would not want to appear on camera with a cold sore. You simply don't look your best. It's very noticeable. It has a social stigma with it, and it is painful. So my heart goes out to them. I understand that it's somewhat of an impossible situation with the casting and with the stress and everything that goes along with filming a 24-hour TV show of this nature. But my advice to everyone would be very careful about who you are swapping spit with, because you don't know what you're getting in that exchange. All right, any questions, please drop them below. Be kind with your comments and take care. Until next time.